so thankful that this was brought up to be able to talk about it, because this is a huge issue and something that I think is sometimes under addressed, especially when it comes to how to fall safely and how to get up from the floor safely as well. So I'm very excited to get to talk with you all, and I'm just very thankful for just everyone that helped put this on and get this to where we are today. So thank you so much. All right. So today, again, we'll be talking about falls management, prevention, and then just ways to fall safely and then get up from the floor safely. And those are our objectives also for today as well. So we want to see kind of how common they are, how common are falls in older adults. We also want to make sure if we can prevent a fall, let's try to, right? So things that we can learn about and ways to prevent them, things that are modifiable and things that maybe aren't as modifiable. And then also how to fall with good and safe mechanics, and then ways to get up from the floor, which I'll actually demonstrate ways of doing that today as well. Okay. All right, so just a few little tips and things, looking at just some stats to start with. So how common are falls in older adults? You've probably heard a lot of different metrics about this, but it's about a quarter of Americans, 65 and older, do fall each year, which is, it's a big amount. And knowing that number, it also increases about 50% once you hit 80 and above. And then, so all of these numbers also translate to mean that every second an older adult falls in the US, which is just, it breaks my heart. I don't want that to happen. So especially with a lot of these factors being modifiable and ways to help with this. And I found this stat about Kentucky specifically. So they did, the CDC did a study in 2020 that looked at Kentucky, and it actually ranked in the second highest category for the most falls and across all states. I think the highest percentage of all of this study was about 38% of people and older adults 65 and older in each state was the highest. But we fall in Kentucky about 31.8%. So that's still pretty up there. And it's kind of interesting to think about why that is. You know, is it access to healthcare? Is it just different factors as far as just health in general? You know, we do kind of rank on sometimes the lower end of those health statistics as states comparison as well. So that can also be something that we need to pay attention to. That kind of brings this point up too. So we want to talk about this. We want to bring it up with our healthcare providers. We want this to be something that's a common discussion between you and your doctor. About half of older adults who fall will not report it because of some of these myths, saying that, you know, I didn't get hurt. I can just no harm, no foul. I can continue on, no big deal. So I don't need to mention that, no problem. Or, you know, I will always lose my independence if I tell them about my fall. There's always going to be a consequence or something like that. And that sometimes we do have to address those issues, but that's not always the case. And then again, it's not a normal part of aging. It doesn't have to be that way. So again, just re-emphasizing that. And as healthcare providers, if there are any of you all listening online as well, this is something that we need to start really thinking about and asking our patients and kind of digging into. And there are some really good ways kind of on some upcoming slides to kind of see or maybe pick up things that might need a physical therapy or therapy referral. So we have two categories here. We have some risk factors that are non-modifiable. We are just in life, we are who we are, and sometimes they are things that just are about life that we can't change. But there are also modifiable risk factors as well. So some of the non-modifiable ones are, you know, your age. We've talked about it, increasingly know that. It's actually more common for older women to be more at risk, also just because of more commonality to osteoporosis, low bone density, things like that can lead to more of decreased strength and falls. And also just our composition, our makeup, we tend to have smaller muscles than men, and sometimes that just allows for a little bit more atrophy and weakness. So that's probably why it's more common in older women. And also race, ethnicity changes there you can see. And then also just having a previous history of falls. So if you have fallen before, you are 2 times more likely to fall again. So that's another reason why it's important to bring this up with your provider if it's become an issue.
The women more than men, is it a large number or is it?
It's relatively close. The percentages I'm not exactly sure on, but it's not a giant difference between the two. Yes, sir. Great question. Feel free to ask anything as we go. And then, Hannah, if you don't mind, if you see any questions pop up on Zoom, let me know. Awesome. All right, and some of the modifiable risk factors here. So you have your gait, your ability to walk, your strength, and your balance. So that is our physical therapy bread and butter. These are things that are definitely treatable, changeable, and things that we can work on in physical therapy. Home hazards, vision impairments, shoe wear, medications, and other comorbidities are just some things that we can be aware of, things that we can change and take a step in the right direction towards. And we'll go into a little more detail of these things as we go on. Okay. So first, gait, strength, and balance deficits. So I listed here some things that we can kind of get to, and maybe if you are a healthcare provider that's listening in, these are some of the things that you might want to hear if you're talking to the patient, you might hear, or you might find yourself saying some of these things or thinking some of these things when you're moving throughout your day. Yeah, you have a question?
What's gait?
So gait means that your ability to walk, your ambulation. Yep, great question. So this means, so if you ever think about having, I have trouble stepping up onto a curb without some sort of hand support nearby, or if you feel like you're having trouble getting in and out of the shower, or when I'm washing my hair and closing my eyes, I get a little unstable and woozy, those sort of things. If you have a lot of fatigue or just going to the grocery store or running short errands very much fatigues you, that is another thing that to be aware of. Noticing a change in your gait, where that can be your walking pattern. So if you have if you tend to lean a certain way, or if you notice your feet make a sound when you walk instead of picking up your feet, those are a few things that you can kind of start keying into that might have some decreased balance and change in your strength there. Or if you're in the grocery store and you have trouble navigating a large crowd or making those quick adjustments. All these things are things that as a healthcare provider or a patient, if you start noticing them, that might be a good time to just have a physical therapy referral and see what they can help for you. So we have some home hazards. That's our next category. So what are some things that you might see or think about in your home that could cause you to fall? Any ideas in the room?
Movable rugs.
Yes, all those rugs that tend to shift and move when they're not kind of stuck to the ground below. Yep, that's a great example. Any other thoughts? TV being in a certain spot, or cords, electronic stuff connected to the TV. Yep. All right, great examples of that. I've got both of those listed here. So I think so you got rugs, you got your steps. If you have other things too that kind of will tend to lead to anything in their way of the common path. So if you know your general routine around the house, if you find yourself kind of like furniture walking as you go also, that's kind of an indication that, okay, maybe I need to make a change in how I'm walking and how I'm safely moving throughout the house. There we go. Perfect. Thank you. What about footwear? What do you guys think? Or maybe ask yourself, how do I get around my house? When I'm in my home, do I get my comfy slippers on? What do I walk around in? Do I not wear shoes? What do you guys think? Do you have a typical go-to as far as shoe wear?
Socks without protection.
Yes, those, if you're wearing socks, having those like stick treads on the bottom is more helpful. Yep. It is really something to kind of think about. If you have house shoes, I'm a big fan of house shoes. I love comfy shoes. But if they do have without a back, if they're just the slide-ons, that's an increased risk for you to fall because there's nothing keeping that from sliding right off of your foot also. I encourage patients to have house shoes that have a back or a heel to them if they are preference to a house shoe rather than normal shoes. All right, and we kind of touched a little bit on these as well, but vision deficits. So if you have areas in your home that's poorly lit, or if you haven't been to the eye doctor in a little while, this is another way that kind of can lead to a fall. Or if you have a history or you're a caregiver for someone that has had a stroke in the past or a brain injury in the past, this is also something that is important to pay attention to because they could have lost peripheral or even vision correctly in front of them on one side or the other. So being aware of that if you're a caregiver and as you guide and kind of help the patient through the home is something to pay attention to as well. So some solutions to that, again, are just having that vision exam up to date, making sure that you have either like smart outlets or night lights placed around your home so that you're never navigating something completely in the dark. And then some other comorbidities or medication influences on falls are listed here as well. But two things I really kind of want to highlight are if you have any blood pressure medicine, a lot of us have blood pressure issues and changes with medications in that category. So whether you've just changed medications, monitoring those symptoms, especially as you go from sit to stand, leading to dizziness, which could lead to a fall, just being very aware of those things. And another one here I wanted to touch on is incontinence. So that can be something that does increase with age, but that means that we're often either waking up in the middle of the night and having to go quickly to the bathroom when it's dark and you're moving quickly, which is not usually a speed that we typically move in. So a lot of that can be something we need to pay attention to and ask our doctors about. That's something else too, is incontinence is not necessarily something that you have to deal with as you age either. There are a lot of options with that as well. There's even physical therapy if that is something you guys are ever interested in. That's another option for you as well. All right, yes, I love that also in the chat, just about home environments being pets. If you have cats or dogs, they like to weave in between our legs or jump on you, and when it's unexpected often too. So being aware of that, and if that is something that you know your dog or cat lends itself to typically doing, environment, having a cane nearby or something, making sure that you are steady when you go to address that pet is really helpful as well. All right. So a few clinical things that I have seen in my practice that I feel like are things that I just really try to explain to my patients. So one of them is, obviously we learned about how much we fall, but what about the fear of falling itself? Just separate from the actual action. How afraid are you of an actual fall? That in itself, just being afraid or concerned with it can limit your mobility. And that can actually cause you, if you know that curb step going down your porch is just really big and there's no handrail and you're nervous, that can really kind of make you freeze up, make you have less mobility and comfort doing so. And that's just one example of that. So being aware and knowing how fearful you are or are not of falling is something really good to recognize and talk with your provider about. And then I've just also noticed a lot with my patients having a little bit of difficulty losing our ability to just simply weight shift. If you're going to go up a step, or if we're going to go even just on flat ground and take a step, we have to have that ability to shift our weight from right to left. And a lot of times we decide and we kind of get fearful and we want to stay in one spot with our trunk. So this is something that I've seen such good results from even the Tai Chi classes here at the Trager Center. But Tai Chi and yoga in general are just so fabulous because they teach that weight shifting and they help your brain and your muscles communicate together that is a safe way to move. And doing so, you can translate that to real life scenarios. So I really do think that is a big benefit. And then these other two here, the speed components, your ability to move quickly if you are having to go to the restroom often and quickly, or just your reaction times, walking through a busy crowd, things like that, have elements to them that if we don't move at that certain speed often, then we kind of lose the ability to safely do so. So I encourage my patients to find a hallway or even with a family member or friend and walk hand in hand with them and try to change your speed. Try to kind of keep that available in your muscle memory, so that you are able to safely practice that when you do need to. Yes, absolutely.
Most of my life, I've been one of the fastest walkers around.
Yes.
And I think I'm through it now, but one of the big changes for me is to slow down and to, I don't have to go so fast.
Yes.
When I'm out walking now, about the only people that I ever pass is a mother with a child walking hand in hand. I can walk faster than them anyway. Otherwise, I'm the slowest one around.
Yes, it is. I have met a lot of people and patients who have walked. Their MO is to go quickly, right? And so the fact that you have that is actually good, and your awareness of that and knowing how to safely, now that things might be changing in your body a little bit, how to address it safely but continue to move well, is really, really important. And I'm going to get to a little more of that too when we do a little bit of the demonstrations later. But yes, thank you for sharing that.
We have a question.
Of course, yes. So how does speed components translate to driving reactions? That's a really, really good question. So the speed changes in your balance and your whole body movement is it's related, but it's probably not exactly correlated with, your ability to, change as far as your reaction time from your brain to your hands or the brake or the foot pedal. We're looking at a little bit different of that mechanics as far as like staying upright with your whole body system versus a quick, foot on the brake or turn of the wheel. That's a really good question. I think they are, like I said, nearby related, but it's a little bit different as far as walking versus that. If you are ever interested in getting a driving evaluation, the physical therapy Frazier Rehab at Newburgh also has a driving evaluation. So if you're ever concerned about, safety with driving, they look at all those aspects and it's really, really helpful. Yep, that's a great question. All right. Okay, so this is the next step in our presentation is just how to fall safely. So if we cannot prevent a fall, then let's learn how to do it the best way we possibly can. So obviously, when you are falling, it is a short amount of time. It is a quick moment. It is fast happening and unexpected most of the time. So with these strategies I'm going to show you, I will definitely, give that grain of salt. We do our best that we can in that moment. A lot of times learning these and then breaking them down and kind of practicing them is, if you're able, is helpful. And not necessarily to the floor per se, but also just even to your bed or things like that to practice that muscle memory so that reaction responds in kind of an innate way. So there's main goal of falling safely is avoiding all of your energy and force hitting in one direct spot. So in these three different ways, you can fall forward, sideways, or backwards. And all of these three, we're going to kind of try to emphasize taking away one point of impact. If we can spread it out or move through that movement, we're going to try to. So the first way is going forward. So Typically, if we are falling forward, we have either caught our toe on something, the rugs, the pets, the things we just mentioned, or we've kind of got too far ahead of our feet and we haven't been able to catch up, and that's when we fall forward. So you can go to the next slide there. So when we fall forward, we want to avoid reaching out, and this is our normal reaction anyways, reaching out and catching ourselves like this on the ground. Reason being, that's those Colles fractures. Our wrist fracture is what is very common to happen in that situation. And again, you're falling on that one point, it takes all the impact, and then that's what happens. And it can also result in injuries kind of up your arm as well. So if we're going to try to avoid that, we're going to attempt to brace your impact with your forearms rather than your wrists, elbows, shoulders, head, okay? So I'm gonna show this again later.
Right.
Yes, so if you're gonna fall, when I was researching this, one of the instructors that was talking to me about this said, you almost want to try to slap the ground when you go down. Instead of coming directly down, you wanna kind of slap the ground with your forearms there. Okay. And then if you fall forward, you want to keep your head up so there's no impact on your head as best as possible. And again, we'll go through a demonstration of those in just a little bit. Yeah.
I was reminded by someone recently that when we were in high school and played football, our fall was to be like this. I mean, of course, we've got pads on and everything, but was to be like this. So that's a lot like what you're showing.
Absolutely. Yep. Keeping those arms closer and not that outstretched hand.
I mean, this is, all my falls have been like this.
Yes, it is so, like I said, that's where practice kind of helps with this. But yes, it's that instinct to reach out and grab something.
Yeah, I had a fall and it happened so fast, boom, it hit my nose. And the next time I fell, my nose said no.
Really? Isn't that interesting?
So I turned my face.
Yes. Our brains are amazing on how they react and learn from past experiences. Yeah. So that's a really, really interesting point that both of you guys have fallen at least forward once, maybe. Yeah, that's helpful. I'm glad you're a football player. That comes in handy.
That was a long time ago.
Yeah. I think you probably still got it. All right, so a sideways fall. This little image here shows two different options of a study that I was looking at. This one says, they're starting to fall to the side and then they turn forward. This one looks at more of a turning backward option because we know that falling sideways is tricky and more common in older adults and because of the instances of hip fractures that you see afterwards. And just the reason why that's so important is just the prevalence of, if you have a hip fracture, it does lead to a lot of more comorbidities and loss and longevity of life after that. So that's why this is so important. So we want to avoid harsh impact on the hip joint only. So really trying to avoid this lateral part of your leg from hitting being the only thing that hits first. And then same thing, want to avoid that reach out to brace. Okay, and that's really tricky on how to do this one. So the same when here, you're going to attempt to tuck your chin forward like you did. You turned your head away, right? Tuck the chin forward to try to kind of brace that impact. You're gonna try again, brace your impact with your forearm. So you're gonna try to slap like this and land like this rather than out and firm like that. Allow your knee and lower leg or your butt and your behind to take the brute force of that impact rather than the outside of your hip. And then the research also says if you can move a little bit with that motion as well. So having that sideways kind of give into it once you hit that forearm, kind of ease into and kind of go with your momentum some will also kind of spread out that impact of that special or that first force point. All right, and then lastly, our backward fall. So this is the one that I think is the most scary personally, because you cannot, you kind of don't know what's behind you. You're headed backwards, and it can be a little scary. So we want to avoid allowing that head to go back without any protection, right? Of reaching back to catch yourself again with that outstretched hand, or twisting in the middle of trying to fall backwards as well, because that just throws you all off kilter, and there's a lot of other injuries that can happen with that. So falling backwards, you want to tuck your chin forward. You actually want to have your arms out wide to reach for the ground, because that's going to kind of help that impact to hit the back of your arms rather than this number.
And
Okay.
also, you're getting a whole lot more area.
Yes,
by doing that.
exactly. And then if you can, again, this is where the practice, if you're able to, comes in handy. Taking a step back rather than just falling back this way. This can kind of allow you to go down, and again, I'll show you that in just a moment. And then landing on your buttocks and move with that momentum to rock back slightly, okay? So those are the 3 ways to do it. So we'll kind of review those really quick. So again, falling forward, you want to have that forearm as your impact. I'm going to use this mat to kind of work on that a little bit here. So I'm going to go in slow motion, but again, as a fall, this is again a really good way to practice is kind of on your bed if you are healthy and able to do so. So as you fall forward, you're going to kind of fall down and try to hit your hands on the mat, okay? And then again, keeping your head upright as best you can, okay? So the slap kind of just reminds you to kind of give that forearm a chance to hit the ground rather than just this, okay? Coming sideways, same option. So again, we're trying to avoid that hip and your outstretched arm. So if you are falling sideways, the best thing to do is kind of brace it with your leg. Again, this is hard to show slowly, I'm sorry. Brace it with your leg, and as you go down, again, you want to kind of turn to where it hits more of your tissue on your backside, and then slap with your arm again. Okay, with that forearm is going to be the best. And then again, if you can, give a little roll with it, that's also helpful, okay? All right, and then coming backwards, I kind of mentioned this a second ago, you're gonna, if you can, try to kind of step backwards to give it a little bit more, don't do that part, sorry. Arms out wide, and then catch yourself here, tuck that head forward, okay? Use the gluteal muscles in the back of your hips and behind are your big powerhouse muscles, so we want to use those as best we can to cushion a fall, okay? And again, I can kind of also review those if anyone else has trouble seeing them.
Are you ready to start getting back up? Is that the next?
That's the next slide, yes.
I've got a question.
Sure,
That
yeah.
relates more to the first. One of the instabilities that I notice in myself is a twist. When I twist, I'll twist to open a door, open a cabinet door or something, and I notice that I'm unstable in terms of the thing. So I was wondering if you had something for that.
Absolutely, yeah. So that's another one of those components that is kind of lost if we don't use it often. The tendency is to kind of stay in one plane rather than, turning, which is very functional and helpful to do, is turn and look.
Does it strengthen the muscles of our body?
There's 2 parts to that. Part of it could be a little bit of a core weakness. But part of it also could be just your comfort and turning your head and staying balanced. So what I would encourage you to do safely, maybe in like a corner or a hallway, would just be to practice like turning your head
Okay.
and getting used to that. Your vestibular and inner ear, all of that will, because if you turn quickly and then you kind of feel off, it's just usually because we haven't practiced that movement as much as we need to. Yeah, that's a great question. Yeah. All right.
I'm sorry I'm late.
That's okay. Yes.
What kind of fall was this that you're showing how to get up?
Sure. So you are just in time to learn how to get up. I showed a few ways on how to safely fall down, and I can also review those afterwards if I'd be happy to do that as well.
Thank you.
Yeah, no problem. All right. Any questions online? We okay? Okay. All right. So what about getting back up? So we are down, unfortunately, but this stat actually, it was done about done in the 1980s, so it's an older study. But they did find that if you are down, even without an injury, and you are down there without the ability to get up for about an hour, your rate of death does increase up in that 6-month window afterwards. That can be because of that hour, if you're down without water, without comfort. A lot of that can be even emotionally, physically. It does really kind of pay a toll on you not being able to get up. So that was something that I did for my research. I was just like, wow, that's a big stat right there. So this is why this is so important. And as physical therapists, we consider this almost a vital sign, one of the things that is really good to keep you active and safe. Yes, ma'am.
I'm always a question asker.
Please do.
Because I have fallen severely. Now, people have said, well, why didn't you have one of those buttons to get up and all that stuff? I have had a stroke and a brain injury, so I can't think that away. And so that's very interesting statistics and everything. So I was down for quite a while before I got myself up. So it was more than an hour. So just wondering, what do you recommend since I was incapable of touching something the way I felt?
Yes, that is a huge, thank you for that question. So I can usually hear our questions, correct? Okay. Just in respect to knowing that, you know, there are certain situations that if you don't wear the life alert or don't have a phone always with you, those are things that are the best if you know that you do have trouble getting up from the floor. But if you know that sometimes you tend to forget some of those safety mechanics and safety tips, the best thing that I would do would be to kind of preemptively prepare your home. Just know that, you know, okay, if I fall in this room, I'm going to make sure there's at least a chair, or make sure there's at least something nearby that I can push up on, or at least have my ability to lean back against, or something preemptively in each room in your home, or the most common rooms that you're in. That way, or another good idea is having like just grab bars and things installed in your home that are helpful if you know you're a gardener and you like to garden and you're out on your porch a lot. And just installing one like near the steps or near the door, just having that completed will also be something that can kind of prepare you for, heaven forbid, something else happen in that moment or in that room. Yeah. Okay, so we're gonna go through 2 strategies to get it from the floor, and I do have a little asterisk there. So there are some comorbidities that limit, you know, if you have had, for example, a knee replacement and it's hard to put pressure on that knee. That's a really common one that we kind of put problem solve with patients. So there are some things that do limit you from being able to put physical pressure on a joint or something like that. And we respect those. I do still think there are great ways to figure out how to do this. But if you do have more of a specific need, talking to a physical therapist or talking to your doctor to get a referral or something like that would be helpful to kind of problem solve each one of the specifics. But I tried to kind of pick 2 that were the most general and helpful to review today. Yes.
My mother's been dead for 30 years. And she lived about my age. But for 10 years at least, if she would have gotten on the floor, she would not have been able to get up. She did not have the ability to get up, which seems to me to be a really dangerous situation. I mean, under normal circumstances, yeah, you contact somebody and so on. But suppose that there were an emergency. And it's going to take another person to take care of them when we've got this fire or something to take care of. And so getting up off the floor, it seems to me, is an essential part of getting older. You know, and we should all be trained how to do it.
Could not agree more. And what's your name? I'm sorry.
My name?
Yes.
Leroy.
Leroy, nice to meet you. Thank you for sharing that again. Yes, it is so important. We consider that a vital sign, and you know, it allows you to kind of have some peace of mind. If you know you can get up from the floor, I mean, that takes away half of the fear of falling itself, because hey, if that does happen, I know I can at least get up by myself, or I know how to try to. So another disclaimer with this, obviously, if you have any pain or are injured, we want to wait, ask for help, or call. That's another reason why those life alert buttons or having a cell phone with you at all times is helpful. But if you do feel, if you are there, I always also suggest patients to kind of collect themselves, take a minute, 5 minutes, get your bearings, make sure that you don't have anything that starts, you know, to hurt after the adrenaline kind of wears off, before you start to move and get up. So these two strategies we're going to go through. The first one, you're going to kind of end up sitting on your side. We're going to get up on our hands and knees, find hand support, and then pick your strong leg, stronger if you have one, and then push to stand up. The second way is we're going to be rolling to your belly, crawling back to push up to hands and knees, and then finding that hand support, the stronger leg, and then just scooting our hips up to the chair. Okay. I'm going to grab a chair real quick so I can set up this demonstration for you. Okay, so we'll kind of go through both strategies here. Okay, so the first one, so we have fallen, and if you're, again, maybe this was a sideways fall and we just slapped our hand like we just learned how to do, right? Landed on more of our behind rather than our hip. And from here, we're gonna try to, if we feel safe and healthy, we're gonna push up to side, okay? From here, we're gonna try to have good hand support. And this is the tricky move. This is probably the hardest part of this technique, is turning over to our hands and knees, okay? You have to have a good core strength, good hips and back support to do so, and then ability to put pressure on your knees, okay? So from here, we're gonna have the ability to crawl towards an object that would be nearby, a chair, a couch, anything like that that won't move on you too much. And then we're gonna have hand support in this, on that object. And then again, whatever knee or leg is stronger, we're gonna bring that one up underneath. And again, you also have to have pretty good range of motion of that knee in order to bend that way. And then from here, you can lean onto the chair, push up tall. And another tip too is to kind of bring that back toe up towards you, because that's, you can push through that leg as well instead of just trying to do all of the force on your front leg. So bring the back toe forward, push forward, and bring that leg underneath you, okay? I suggest to my patients too, if they use a chair to get up, you know, come forward, sit, again, regain yourself, kind of see how you feel, and use that strategy that way. So that's option one. Any questions on that method? Okay. All right, second method. We're gonna come more kind of catty corner to the chair this time instead of having it right in front of us. So let's say that we've fallen backwards this time, or on our side. Either one, any fall, you can kind of adapt to these positions. But we fell on our back, we've kind of landed wide, tucked our chin. From here, the best way to roll to our belly for the second method is to prop one knee up and reach across to roll to our sides, okay? From here, again, we're gonna kind of prop up here and roll to our bellies, Okay, so this part you don't have to have as much of a turn with those knees, the pressure on your knees quite yet, which is nice. Or if you have fallen forward, we're already here, right? So from here, one of the researchers that I looked at when I studied this said it really is helpful if you don't have as much ability to push up. You kind of crawl backward on those forearms, and naturally your hips just kind of go up, okay? From here, I'm gonna adjust this chair just a little bit. From here, you can crawl to the chair if you need to, but what's a really nice thing about this is if you have wrist injuries, you don't have to push through them as much here also. We're gonna grab the chair to the side. That way it already helps you lift up, okay? Same thing, you wanna have the strong knee come up if you can. And then from here, having your hands on the chair beside you, you're just gonna kind of swivel your hips up into the chair. That's another way that doesn't require full stand up or push through your legs as much. And you can just slide those hips up into the chair. Makes it a little bit easier coming that way.
One of the things that I became aware was dehydration. And people don't realize how it can be fatal, because I had an incident and ended up in the hospital. But another time, I lay on the driveway with my head had landed in a nice patch of ivy, and I was too weak. And also, I was pulling the recycle bin, and it was across my legs in the back. So I could not get up. And I had the iPhone, and I woke my daughter up.
Yes.
So, yeah, but dehydration is something that I don't hear it talked about very much. And I'm amazed how little water a lot of people, and my sister-in-law doesn't even like to drink water, period. So I think that can be a major component to falling.
Absolutely.
That's very good, because I should drink more water. I drink, but not enough. When you were laying there, my fall, that was severe, I got to the flat.
On your belly? Okay.
Finally got there, but I was in really bad pain. So, but I had no chair. So, I did hurt my hands and stuff and everything, but I pulled myself to my couch. And,
Pulled yourself to your couch?
yeah, like
Okay.
that.
Belly.
With
Yeah.
arms just pulling, because my leg was in so much pain. And then I was able to get up, able to get myself into some kind of semblance of rationale, and to get, you don't want to hear a story, my family didn't come. So a friend of mine came from way on the other side of town to help me and get me. And I just, as my brain injury, I should have called 911, but I have that problem. But I had my phone, but now I don't have it on today, but I had the Apple to where I can hit the Apple.
Yes.
iPhone. I didn't know that if you get the small one, which I don't have on today, you can just do the hard stuff and hit the emergency. You don't have to have all that other stuff on there.
Isn't that amazing what they've come up with? A lot
Yes,
of
you don't have to have
technology.
that big expensive one. You can have the smallest Apple Watch. But that is how I did. Now, is that safe as bad as I was hurting? Because I can tell you, I ended up being messed up.
You know, our rule of thumb in general is just to do no harm. So if you, especially if you are hurting in some way, Obviously, if you have no way to communicate and no way to, get to that safe step, there are times where you have to do what you can, but in general, the best thing to do is just try to kind of stay prepared, like we talked about. Interestingly, a lot with the Apple and even all the phones even have like applications now that if they sense a fall, they can automatically call emergency services. So if, especially the watches as well, if they sense that you have fallen down and then there's like no movement after, sometimes they'll and you can set that up on your phone as well. So there are some things that you can do, but in general, if you are down and injured and you know it, the best thing to do is stay until help arrives.
So your chair has been by your fall, but I'm thinking lots of chairs are not by the falls.
Excellent.
So you could crawl to the chair or you could roll to the chair. Things that we should be practicing, maintaining our ability to do.
Yes.
Or pour yourself to your chair.
Well, army crawl sounds like what
kept-
she did.
I just kept, moving myself because I couldn't move. My legs hurt so bad. The way I fell.
Yeah.
It was kind of, this was down and this was out. And the way I felt, I just was able to roll over and that just stretched because I couldn't come up on my hips. It was just way too painful.
Yeah, I think sometimes too, we forget about, again, if you are safe enough to roll, a roll is sometimes a good option if you've fallen on your back or your side. That way you can have a little more ability to manipulate the environment. But yeah, crawling towards the surface is something that will be really helpful, yeah. Okay, great questions, thank you. All right, the last few things here we'll talk about. So I think the last to kind of summarize everything that we've kind of talked about. So I wanted to just address caregivers really briefly, kind of what we've already touched on. So how do you know when it's safe to help a family member if they've fallen? So, say you're the son or daughter that comes in and sees your parent or caregiver, family member down, always assess the scene, make sure that the individual is safe before you take any steps. So you want to make sure that they have, vitals, are they responding, all of those things. Always check that out first. If the patient is safe and, you don't see or they are reporting that they're not hurting, there's no injuries, then you need to assess how much help that they actually need to get up. If we're the only one around, sometimes learning these strategies to help show them how to get up can be helpful. But what we don't want is you as a caregiver to strain your back trying to help them get up, and then you can't care for them as well as you need to. So we just want to respect those things and have good mechanics with those as well. But then if you assess that they need more help than you can offer, again, don't. There's no need to try to hurt yourself. So try to either show them what we've talked about today or call for help. We always want to just do no harm in this situation. And caregivers, thank you for what you do. It's a tremendous job, and we just appreciate all the things that you've done for your family. So and kind of just in summary today, just that falls don't have to be a normal part of aging. There are a lot of things and interventions that we can do to help. If you have done all that you can to prevent it, but it still happens, there are ways to do it safely, as we've talked about. And then getting up from the floor and practicing things like that, even on your bed, if it's safe and you're able to do so, is a really good skill to keep up with. And again, in physical therapy, if this is a goal of yours, we can even do like a one-time evaluation, teach you these things, give you the exercises to try and try them at home. And it doesn't even have to be like an ongoing thing. It can be just a one-time visit kind of scenario as well. And then just don't be afraid to talk about these things with your healthcare provider. Again, we've just talked about how important it is to have an open communication with them. And same thing, doctors asking good questions of us to kind of get to the bottom of these issues. So All right, are there any questions, concerns? Anything else to come up? I did include just some fall prevention guides here online for both providers and for individuals who are interested in this content. These two websites are fabulous. They have a lot of tips and tricks in the book if you ever need those. And I think this handout and presentation will be sent out as well. Is there questions?
It looks like we have a question online.
Okay.
Misty, if you want to unmute.
Yeah, I just have a question for you because falls has been a topic we've talked about a lot with my family recently, and it had been suggested to us about the Apple Watch and that it might be able to detect falls. And I know there are other types of smartwatches out there. Are there any smartwatches in particular that you recommend that help in detecting falls?
The most common one I have heard is, again, the smaller, like you don't have to have the big fancy Apple Watch, but there are other smaller ones, or I'd have to look up exactly, but I do think that Fitbit and Garmin also have the option for that. The Fitbit and Garmin ones may be more of the newer ones, or the newer models, but I know for an Apple Watch, that's been a feature on there for a good amount of time. So I think those are usually the ones that I hear the most often. Yeah.
I did a lot of research and I found, and I even bought a really cheap watch that was on Amazon that said it did a lot of stuff, and the battery time was so bad. It didn't even last even 4 hours. Seems like it lasts only 4 hours and you had to recharge. So that's when, and I'm not trying to promote Apple because I can't stand them in a way, is that they have the smaller one and it's like, I think now $50.
Okay.
Or something like that, but unfortunately you have to join it, you know,
Yeah.
but, and everything compared to the hundreds and thousands or something, but that's how I got mine. And I got my elder sister one because it was a 2-for-1 deal.
There you go.
And I sent it to Georgia for her.
That's great. And I'm sure too, I know that the, like, you know, you've started the life alert, all of those things. I'm sure they have progressed also over the years to maybe even having something you wear on your wrist instead of around your neck or something like that. I'm not entirely sure, but that's a really good question. And hopefully that helps. Any other questions? Yes.
One of the sort of fears that I have, it's not like I'm really afraid, but sometimes I'll come to a stairs and the stairs in my house, we've got rails on both sides and it's safe and so on. But I get this picture in my mind of falling down those stairs. And I would think that would be one time to fall back. If you were falling on a stairs, you would falling back so you don't fall forward and would be a shorter fall.
Are you talking about going down the stairs?
Down the stairs, yeah.
Yes. Yes, that's the stairs are always a little bit trickier, but yes, you would want to, out of the two, probably fall back and try to sit on the step that you just left, things like that to try to, and again, reach out to the sides, right? That would be a really good instance to use as wide arms. That way you could catch the wall or the step beside you, and tuck that head forward, so you're not hitting the back of your head. Protect the head at all costs. Yeah. Okay. Any other questions? No problem. If you guys have any other concerns, questions, feel free to reach out. I'm happy to answer anything. And again, myself, and then Laura is also a physical therapist upstairs here at the Trager Center. Happy to answer or evaluate, do anything that you guys need. And if there's any other questions that come up about falls, I'm happy to address those as they come and do another presentation like this. That'd be great. So thank you all for bringing these questions to the forefront. We appreciate it. Thank you everyone for attending on Zoom as well. We appreciate you guys. Thank you very much for listening. You all have a great day. Thank you.
Thanks so much, Shelby. And I would like to say that everyone who has registered for this class, I will send out a link to access the recording and also a copy of the PowerPoint presentation.
Awesome. Thank you, Jessica.
Everybody.
Thank you all.